MedBricks Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. So, welcome to the MedBricks Webcast. This is Raman Raju. I'm the host. I'm not Albert Einstein. Maybe my two guests of mine, or maybe Albert Einstein. I think very few engineers. I came from a family of engineers. I never been into politics. My family, I'm a little bit here and there, daggling around politics. But I tell you, this is a very important. I was talking with the Dr. Sophia Yen, and we need to have engineers and doctors to get into the politics is important because to be voiced, to be heard. Anyway, we have a privilege to honor to have our Sunnyvale mayor. That's the epicenter of the Silicon Valley. In fact, the most of the companies, including Sophia Yen's company, is based in Sunnyvale. Sunnyvale is a epicenter of the capital of the technology here. And then we have the Vinci, the robotic surgery company, Institute, that is based here in Sunnyvale. And then Ceribell, there's the EEG company. Then there is a few other companies. They're based in Sunnyvale. It's a really privilege and honor to welcome Mayor, and then my friend, a good friend, welcome Sophia Yen, the pediatrician Sunnyvale. She'll be there also along with me, all three of us. Welcome, Mayor.
Thank you.
Welcome to the MedBricks Webcast. Let me put you in the main stage. I don't know how to do that, but I'm working on it. Technology is not okay. Anyway, let me talk with you, Mayor. Welcome. Let me turn off this music. That is your background, I think.
Yes, it is. Sorry.
Mayor, I wanted to ask you a question. I'm a family full of engineers, and there is a doctor here. They don't venture into politics. What turned you on into politics to get into politics?
So it was just giving back to my community. So I've been an engineer in Silicon Valley starting about 35 years ago. So computer science major from USC, and Silicon Valley was the obvious place to come to, and never thinking I'd get involved in politics or anything of that nature. But first we bought our home in Sunnyvale about 22 years ago, and I started going to outreach meetings to define what the vision of downtown is. And 20 years later, that vision is almost complete. But that started getting me involved in the city and trying to figure out how to do better. And so I was on the planning commission for about 10 years, over 9 years. And then I saw a dysfunctional city council, and I made the decision that I could do that job better than other people up there. And so, especially as a computer science engineer, I was more of an introvert, but I've learned to be an extrovert, trying to make sure that, I'm available to people. I no longer have a fear of public speaking or giving speeches or anything of that nature, but, just picking up those skills over a period of time, because that's what you're forced to do. And you learn, sometimes the hard way about how to be a good public servant.
It's Sunnyvale. I'm from Atlanta, Georgia, but I moved here. Atlanta, Georgia is Marietta is fourth, the best living places for the homes that you just posted on your Facebook. Marietta is my city. Right after that, Sunnyvale. I belong to both cities. I'm privileged about that. You became a mayor during the pandemic, middle of the pandemic. So tell us the experience that's more relevant to us, and the doctor is here. Just tell us your experience as being joining in the storm right there. So tell us what kind of hits you took it, and how you came out of that kind of you are very successful in doing that. Give us your background a little bit about that.
Absolutely. So from a city standpoint, and from a mayor, I've been mayor for 5.5 years. So I had 1 year of let's say, normality before COVID hit. And when COVID hit, nobody knew what the next day might bring. The changes, the requirements from a county standpoint, from a state standpoint, were constantly changing. Masking and vaccines and social distancing and all that. For me, it was a learning experience, but I was also president of the Cities Association of Santa Clara County. So it was working with, getting all 15 mayors in the county to say, county, please partner with us to try to figure out what we're going to do, how to find a way forward for county health, because cities normally aren't in charge of health of their residents. They're in charge of the safety, dealing with public safety and all that. But when you're talking about health, cities normally don't have a doctor on duty. So from that standpoint, it was all a learning experience. But it was working regionally with the other mayors to try to figure out what we're going to do on a daily basis, and finding out, learning a lot, learning the hard way of what we should do for masking, for vaccines. Sunnyvale is actually pretty unique because the iHealth, the orange test kit that everybody in the U.S. knew about, they were actually headquartered in Sunnyvale. During COVID, so all if you read the back of the orange high health, COVID test kits that you got, Sunnyvale was listed there, and they tried to expand in Sunnyvale, they couldn't. They moved to San Jose for a short period of time, but then when a building opened up, they moved back to Sunnyvale. They knew where they wanted to be. They wanted to be in the heart of Silicon Valley.
So Sophia, so you're a doctor, so really, when compared to a lot of cities, so Sunnyvale did very well. So just tell us your experience, Sophia. What do you think of that experience during the COVID?
I think that, COVID was a huge opportunity for those of us that were in telemedicine and Pandia Health. We were ahead of the wave. We opened in 2016, and I always like to say, founded in Sunnyvale, the heart of Silicon Valley. So that's always fun. And we have asynchronous telemedicine. So that is particularly good for what we do. We do reproductive health. And so oftentimes the research has actually shown that if you ask a person a question on a questionnaire, they're more honest than if you ask it with a video and with a phone. And luckily, California is a progressive state that is open to asynchronous telemedicine. And so Mayor Klein, if you're not aware, Pandia Health is the only women-founded, women-led, doctor-founded, doctor-led, moms-founded, moms-led, birth control, telemedicine, and pharmacy under one roof. And we just expanded to menopause because I hit menopause age, and all my friends are like, menopause. And I'm like, yes, I will find the best treatment for me, and I will share it with all of you. But from our birth control side, we absolutely saw a boost with COVID. My husband's joke is that everything that's bad for the world is good for my company. So COVID, bad for the world, great for telemedicine and for people understanding what asynchronous telemedicine is. And then the Dobbs decision, horrific for anyone who believes in bodily autonomy and women's equal rights and reproductive freedoms, but a huge boon to our company because all the women woke up and are like, yes, I need my birth control automated. And the point of Pandia Health is no one runs out of birth control in our watch.
So you did everything from the center of Silicon Valley. That is a credit to the mayor. Mayor, that one of the things is that you, not because you are president of Santa Clara Association, Mayor's Association, you led a team and then he signed a letter to all together. He brought them together, not all the mayors together is not an easy thing. You did that. To tell us of that experience, particularly response to a healthcare crisis, you did that. Tell us how you did that. And it is very important for other people to know how that's important times to get into.
No, absolutely. So thank you for that. And of course, I just want to thank, Sophia for your hard work, and Sunnyvale is blessed to have fantastic companies like yours here, and so I appreciate what you're doing in our city, and especially from women's reproductive health, which has been critical over the last especially 2 years. But as far as pulling all the mayors together, it wasn't an easy task. I'll say we have so Sunnyvale is the second biggest city in the county and the seventh biggest city in the Bay Area, but we don't get a lot of recognition. And so it's trying to get mayors of all cities of all sizes, from large, medium, and very small cities in the county, to agree and put their name on, on a document. But they saw that was, a critical thing to figure out that the county, because the county in default would always default to, well, whatever we do with San Jose, and San Jose is half the population in Santa Clara County. But there's another 14 cities there that really, have to have some sort of focus, especially when you're talking about public health. And then, of course, you need to be careful what you ask for. So what, when I sent that letter to the county said, sure, we'll partner with you. But what that meant ultimately was, let's have a Saturday morning meeting for the next year and a half. So where county health, where mayors from all over the county, where city managers and several supervisors from the county all met to talk about what the issue of the week was, because every week there would be brand new issues, whether or not it's direction from the state or from the federal government, or it's just dealing with, how do we distribute vaccines? What are we going to do for managing healthcare for our people and providing it as equitably as possible across the county? So yeah, you always, it wasn't an easy task, but I'm overjoyed that I was successful to put that coalition together. And it really made a big difference, because, as we first went into lockdown, and then as we started to open up, every week, we'd have a different direction from a health standpoint, and trying to figure out how to manage that was the important thing.
You did a commendable job. Is it 911 response is based on county, or is it cities involved? Your city is involved a little bit. Just tell us a little bit about 911 response, and then how it works, ambulances and all those things. Is completely run by county, or in Georgia, counties run, not cities. But in Atlanta runs. Very confusing a little bit. Tell us a little bit about the 911 response.
So 911 is run by each city separately. So we have our own dispatchers within Sunnyvale that evaluate what the issue is and send out public safety to deal with that problem. And Sunnyvale is actually very unique, because we have a merged public safety model, which a lot of cities don't have. So we have the merged, every officer in our department is trained in fire, police, and EMT.
Whoa.
So ultimately, we actually have fewer officers, because we don't need a full fire station full of firefighters waiting for a fire. When every police officer driving around our community actually has full fire turnout gear in the trunk of their car.
Whoa,
so when there's a fire, our police officers drive to the scene, pop the trunk of their car and pull on their fire fatigues. Or often, because they're constantly driving around the city, they are first on the scene, and conceivably you immediately have a firefighter at that location, to deal with, if it's a small issue, or deal with, a public health issue. They're immediately on the scene to provide EMT services. So we pay less per capita than any city in the Bay Area because of that model, but we
Wow.
they're highly trained from a certain standpoint. And it also, I think, makes a better officer, because everybody loves a fireman. Some people are a little afraid of the police, but
Yes.
when they're one officer, it really makes a difference, because it gives them a better mindset. Because if they get tired of working in the police and in the police portion, and every person they meet might have a gun, they can transfer to the fire department for years. And we have officers that spend their entire time, their entire career in Sunnyvale Public Safety, and constantly are switching back and forth between the two different disciplines.
Amazing. I didn't realize that you came up with a very unique model and a novel model. And in fact, it's a very good idea. The ambulances are run by the hospital itself, or city is
The
also
county-
involved.
County, because ambulances kind of run across the county to different hospitals. The county is actually in charge of ambulance service and paramedic service to a certain degree. So we make sure that that the patient is as stable as possible, but then ambulance services come in, because that's across different cities, and depending upon, and because there's different hospitals in different cities, where they might be taken to is dependent upon what that, conceivably what that patient says. Oh, I need to go to this hospital, but it's not in that city.
Sophia, you have any questions on vaccines or the medical side?
I think that, California has done a great job with the vaccines rollout as well as masks and other things. I just personally have come off an airplane and have heard a ton of people getting COVID. So I just wish the airports would hand out masks to anybody who's coughing, that just be like, if it isn't allergies, why don't you put this on before you get on the plane? Like protect the rest of us. In Japan, they always wear masks to protect other people against themselves. You know what I mean? So if you're like coughing and you're in an airport and you don't have allergies, please put on a mask. Would it be too much to ask to have the public health people just hand out a couple masks to anyone who's coughing? And it's not like forcing, and it's just like, maybe you want this mask, do a good service, or have some signs up that says cover your cough or something. But on the public health side, I did propose to the Department on the Status of Women, and maybe Sunnyvale wants to take this on, Mayor, some women-friendly policies. Number one, I would like to see wherever there's free toilet paper, there should be free menstrual products. So Starbucks, your place of employment, because I know that they have mandated it in California, K through 12, and the Cal State colleges, but it's not everywhere, right? So that's number one. And then number two, I'm adolescent medicine. I like to prevent unplanned pregnancy. So we propose to the Committee on Status of Women, either on the back of every bathroom stall or one per public bathroom, just a sign of all the birth control methods by the CDC. It's an 8.5 by 11, laminate it, stick it up, and just have it where you wash your hands so everybody can see the methods. Because I give talks all the time on YouTube, TikTok, and Zoom to different groups. I'm like, quiz your doctor. Ask them, what is the most effective emergency contraception? Ask them, what is the most effective birth control? And you'd be surprised how many people get it wrong on this CDC chart. The only reason I know is because I studied the CDC chart and I'm passionate about birth control. And then another public service announcement is that a lot of people are they are offering emergency contraception in vending machines at colleges or whatever, but it's really important for people to know there's a body mass index limitation to emergency contraception. So it would be sad if somebody bought or got over-the-counter emergency contraception, took it, thought they were preventing pregnancy because of their body mass index. Doesn't work. So if your body mass index is 26 or greater, and 66% of the US population has that, and it could be you're just a totally buff tennis or volleyball player with a ton of muscle, that you have a BMI of 26, then it doesn't work. And so those are just a couple of public service announcements I would love to put out there, and be happy to, consult or just, verify that the facts you put on there are good.
The Mayor, one more thing I wanted to ask you about the mental health. So what is when your 911 response in a lot of cities like Atlanta, sometimes police, and they get confused with the mental health problem with their criminal situation, and then people get hurt. So do you have some kind of plan during this kind of things to the response, 911 response?
So definitely, some cities have put in kind of a mental health responders, so dispatchers to figure out who to send out initially. We're looking at that, but this is part of the training. This is ultimately dealing with mental health, physical health, that whole EMT, and kind of the additional training, because we pay our officers a lot more because of all the training that they go through. But they're also mental health experts. This is part of the thing. But definitely there are cities that are looking at that. Looking at different response, to mental health cases, and we're evaluating that as kind of a separate group of people. That being said, the worst possibility is the mental health a mental health person arrives and that person has a weapon or something of that nature. And so that's always the worry, from a lot of cities of, putting someone who isn't ready to deal with, let's say an extreme condition in harm's way. And so we're evaluating that. We're looking at what other cities are doing, but yeah, we haven't gotten there yet as far as trying to find the mental health first responders.
Mayor, one more thing I wanted to ask you about. You're a very champion of climate, sustainability. I remember you doing a big yesterday invitation to all your citizens. Tell us a little bit about your passion for yesterday, clean air, and the parks. Just briefly, if we can talk about that, that would be great because it's a very important part of the health, right? The Sophia, it's a very important. You have a parks for the children, and you have three children, and all of them. It is a great to have parks and all those things, Mayor. So, what do tell us a little bit about that?
Absolutely. So from a city standpoint, it's one of, sustainability and creating more open space is one of our priorities. We've opened in the last 10 years, we've opened four new parks. So it's actually been very good from that standpoint. But we ended up just redoing our city hall, and so we tore down the old city hall, the old annex. A small office park. We built a 4-story building, and ultimately we ended up opening up 6 acres of open space around our city hall. And it's that commitment. We're currently renovating. We got a 20-year plan to renovate all of our city parks. So spending $200 million to make sure that, for one thing, they meet the changing needs of the community. But the other half of that is making sure that they don't get to the state where playgrounds are collapsing or there's safety hazards within our parks. And we live in Sunnyvale. We live in a beautiful city, so making sure that people get out, enjoy the good weather, enjoy that open space is great from a health standpoint and a mental health standpoint also. Yeah, I think that was one of the biggest things that we came to mind for everyone during COVID is it's like being secluded, only staying at home really adds to depression, adds to mental health issues. Being outside, going on a walk, visiting your city parks, that is critical. Getting that support, getting that just exposure on a daily basis to the sun, that is really something that every person should take to heart, is looking at their personal mental and physical health.
Yeah, absolutely. You know that American Medical Association and all those places, they're saying a lot of the doctors need to small space for the green space to build around the hospital systems. Then because they can relax a lot of healthcare workers under a lot of stress. Sophia can testify that. So that's a great idea. Well, he was talking about more yesterday and sustainability and clean air and a green space. Sophia, you have any comment on that?
No, I think that's great. And I love the fact that you bring in that healthcare workers really could use that as well for like meditation and stress. And, in the hospitals, all sorts of sad, horrible things happen. And as physicians, we feel a lot of stress. As healthcare workers, we feel a lot of stress. And I've definitely seen burnout in the healthcare community. A lot of people just leaving the industry after what happened with COVID and people just refusing to do vaccines and masks and expecting doctors and healthcare workers to die for them. It's like, if you're not going to get vaccinated, I shouldn't have to die. This is before we had effective treatment and before we had the vaccines. And so a lot of healthcare workers have been jaded, but I love the going out, getting sun, get a walk. Everyone is vitamin D deficient. So go get, 10 to 15 minutes of sun exposure. Can be just through a window, but get some sun every day and check your vitamin D levels for sure.
So, yeah, Mayor, another thing is that a lot of times you bought a lot of good companies, like Intuit is a home of the Intuit, is a Sunnyvale. You attract a lot of high-tech companies came in, particularly healthcare biotechnology companies like Pandya Health are centered in Sunnyvale. Tell us a little bit what you created, what it takes, because I'm a friend of I'm also close to Atlanta and other cities. So tell us what he did and attracted to all these high tech companies to come to Sunnyvale.
So Sunnyvale is a wide variety of companies, and so we have over 7,000 companies. Not all of them tech related, and actually 90% of them have 25 people or less. But it's creating that space. It's a very safe city. We're normally in the top 20 safest cities in the nation year after year after year. but it's just creating, the open space and all that. Being a well-run city attracts business to it. And, we're one of the few cities where you have all the big marquee companies, the Apples, the Googles, the LinkedIns, the Amazons, all the consumer products for Amazon are designed and built and prototyped right in Sunnyvale. But you also talked about the medical industry. So I mentioned of course iHealth and the orange
Yeah.
test kit. But as you talked about Intuitive Surgical creating their Da Vinci surgical robots, we have lots of mini, so we have Cepheid that's working on vaccines of different types. We have Silk Road Medical looking at medical devices to do, arterial ablations and trying to make sure that
Yeah.
people, can actually be safer when they're working on their arteries and clearing that out. And so it is still an innovation, whether or not that's, computers, is that AI, or is that medical? And having that diversity within your city also means that each of the companies that are looking for support, those small companies that provide this device or that device to make sure that each other company is successful, is also in the city. They have a presence, and that mixture within the city makes it more successful, because throughout the years companies rise and fall. Sunnyvale was the birthplace of the video industry. Atari was founded there. We had Yahoo, but Atari and Yahoo are now gone, and you see that it's like NetApp was very strong in Sunnyvale. AMD used to be located in Sunnyvale, but you see these companies go up and down throughout their lives, and so having that diversity is also very good from a city standpoint.
So yeah, another thing is that I'm not a spring chicken anymore. I'm getting older. I saw your post that really touched me. You said that not only we need to take care of the young people, we have to really understand the older people and really give all these facilities and make sure services are provided to them. Tell us a little bit about that. That's very important, because some of the cities ignore older people. They don't understand the too many steps, too many things, too many that you need to facilitate a lot of things for them. Just tell us a little bit that you were really concerned about that, as it caught my eye.
No, absolutely. And so, it's mental health, but it's also, the physical health. We have a very, an aging population. Everybody is a day older. Seeing that, especially in Silicon Valley, we're having a lot of young cities where millennials are moving. That being said, we have a very large aging population, and that's Sunnyvale, that's the Bay Area, that's across the U.S. that we're seeing that older population continue to grow, as people live longer. And so for me, one of the big things that we do from a city is do outreach specifically. We have a senior center. We have areas that we bring people in. During COVID, we used to have people come in for food. We actually delivered food, and we were doing phone calls. Staff was actually calling, our seniors to make sure that they're okay, that if they needed medication, if they needed food, if they needed, anything, they were actually doing outreach to make sure that they were surviving COVID, and personally, I delivered, lots of toilet paper, lots of personally made masks those first 6 months of COVID, because it was so many issues, the supply chains, and just getting what you need. But all of our cities are focusing on that aging population, source wise, of trying to figure out how to best deal with the needs of a senior population.
So without getting into a lot of politics, let me ask you, presidential debate is coming in a few minutes. So what is your opinion about it in general? And then after that, we can wrap it up. Tell us a little bit about you're also running for a re-election. So, the Sophia and the people like that, need to support you. And I think you're doing a great job. But a little bit, tell us what is your opinion in general, how important these elections are now in the democracy, the part of the democracy.
Absolutely, the democracy is in crisis, and you have lots of issues from AI generated items, and the trust that people have. People can make the most difference locally, and not that I'm not going to miss the debates later this evening, but that it is critical to hear what our presidential candidates are saying. And most people are going in already decided how they're going to vote. But it is important from a process standpoint to hear what people's stance are. From a mayor standpoint, I'm a long-term Democrat, but I am it's a nonpartisan position. I represent everyone in the city, whether or not you're a Democrat, whether or not you're Republican, Independent, or other party. So at a local level, you really make sure that you do whatever you can for everyone in your community. You have lots of people under 18 that can't vote yet. They're just as important as people that are voting for you or voting for your opponent on every election. For me, it's running an election. Yes, I'm running in November. People can learn more about me at LarryForMayor.com and kind of what I've been doing, but it's trying to make a real difference in your community, whether or not that's the business community, the tech community. But for me, Sunnyvale is a diverse city. We have, more than 50% of our residents were born outside of the United States from all over the world. And that diversity makes our community better, that diversity of residents, that diversity of businesses. It is really a great city to be there, to be in charge of. And for me, it's making a difference. And for me, I gave up on tech. I got laid off from my tech job a few years ago. And now this is my full-time job because I love it so much.
I was privileged to meet you a few times, and Sophia, you should make an appointment with the mayor and then talk about all your concerns. He is a very responsive, very, very individual. Thank you. It's so much privilege to talk with you, Mayor. I took your time. It's a really privilege. It's an honor for me to talk with you. It's a Sunnyvale is a jewel of the Silicon Valley. You're the best example of that. Thank you so much. Thank you, Sophia, for coming on the presidential debate. She's worried about her company's future with this debate, and so she's worried about which way they vote. So thank you all for joining with us.
Thank you for having me, and thank you, Sophia, for what your company's doing and fighting the good fight. Thank you.
Thank you so much for having me, and an honor to be here with both of you.
Science is real. We brought vaccines with unprecedented speed to face the present global pandemic. But it is not possible without the help of great giants of science and medicine from the past. We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. This is Jennifer, Vice President of Branding at MedBricks. Microsoft founder Bill Gates says, reading about history of science and learning about scientists of the past are an integral part of understanding and appreciating the true science.
If you want to learn science, reading the history of scientists and the story of scientists about when they were confused and what tools or insights allowed them to make the progress they make. So you have the timeline, or you have the map, or you have the branches of science and what's known and what's not known. So incremental knowledge is so much easier to maintain in a rich way.
Talking about scientists, Marie Curie certainly is on top of the list. Despite public shaming about her affair with a colleague, she won the Nobel Prize twice. She designed the first ever medical mobile X-ray trailer called Petite Curie. It saved countless lives during World War I and subsequent wars. She was a prolific scientist and a true feminist of her time. C.V. Raman, scientist from India, and his discovery, called Raman scattering, is fast becoming an invaluable instrument of a diagnostic tool in medical imaging. His discovery is omnipresent in every area of medicine. Paul Dirac of England scribbled a mathematical equation that paved the way for present-day medical wonder called positron emission tomography. It is referred to as PET scan, which is widely used in detecting tumors and cancers with the utmost precision. History might have forgotten Dr. Yella Pragada Subbaro, but his contributions to the world of medicine is hidden everywhere. This Indian-born medical scientist created the first ever chemotherapy drug called methotrexate that saved countless children with leukemia. Now, the drug is being widely used for other types of cancers. It is also used in the treatment of ectopic pregnancies, rheumatoid arthritis, and several other conditions. He is instrumental in creating the first broad-spectrum antibiotic drug called tetracycline. Let us bring this iconic man, Dr. Yella Pragada Subbaro, who comes from a small town from the state of Andhra Pradesh, India, to the front lines of world history through Daily Wear for Medicine t-shirts. With extraordinary data analytical skills, might have been known as a lady with a lamp in the history books. She was the first woman to use population health analytics to fight infectious diseases. That is Florence Nightingale. British-born aristocrat Florence Nightingale championed the welfare of wounded British soldiers during the Crimean War. She put forward a detailed sanitation infrastructure plan for India to prevent mosquito-bitten malaria and other communicable diseases. She is a brainy mathematician who happened to be a nurse with unbounded compassion to fellow humans. We at Daily Wear for Medicine honor Florence Nightingale through this t-shirt representing every nurse and nursing student following their footsteps of the Nightingale Pledge. We at MedBricks are bringing these remarkable stories through visual art with our patented designs called Daily Wear for Medicine. T-shirts, conference bags, and other forms of merchandise are available through popular online networks. Creating visual art is one of the defining characteristics of the human species. We hope it creates awareness and reiterates confidence in the field of medicine, particularly in times of crisis we are in. We hope you join us in this journey in paying tribute to the contributions made by scientists and physicians alike. Thank you for watching. You can wear it, carry it, and give it.
Best example of that. Thank you so much. Thank you, Sophia, for coming on the presidential debate. She's worried about her company's future with this debate, and so she's worried about which way they vote. So thank you all for joining with us.
Thank you for having me, and thank you, Sophia, for what your company's doing and fighting the good fight. Thank you.
Thank you.